Come in.
I'm gonna wash my hands. Hi, Mr. Piatek. How are you doing today?
I'm doing good. How are you?
I'm good, thank you. My name's Liz, and I'm going to be doing a neurological assessment on you today. Would that be all right?
Yes.
Okay, so we're gonna start off by looking at you, and I'm just gonna state some things out loud. So looking at his appearance, I can see that he's well groomed, he's dressed appropriately, so his appearance looks normal. You're able to respond to me and you're awake, so he's alert and awake. His level of consciousness, he's in an appropriate mood and able to communicate with me. So we're gonna test your orientation, so I'm gonna ask you some questions. So can you tell me what my name is?
Elizabeth Piatek.
Okay, first name is okay.
Oh.
Can you tell me what your name is?
Arthur.
Okay, can you tell me what year it is?
2020.
Can you tell me who the president is?
Donald Trump.
Okay, and then can you tell me where we are right now?
Home.
Okay, and can you tell me what me and you are doing right now?
A video.
For what?
Class.
Okay. Okay, so he's alert and oriented ×4 to time, person, place, and situation. So now I'm going to ask you some questions to do a basic screening for anxiety, depression, and suicide. So I just want you to answer never, most days, or always to my questions, okay? So do you ever feel so anxious that it's hard for you to do your normal activities you do on a daily basis?
No.
Okay, and do you ever get so worried you feel like you can't function properly?
No.
Okay, and then do you ever feel so sad that you're unable to do the things you enjoy doing?
No.
And do you ever feel so sad that you feel like you can't get up and do your normal activities that you normally do? Okay, and then do you ever get so sad that you have thoughts of hurting yourself?
No.
Okay, and then do you ever have any thoughts ever of not wanting to live?
No.
Okay, so he had never to all the basic questions. If he would have answered most days or always, we would have done a further in-depth assessment based on those. So now we're going to move on to the cranial nerves. So we're going to start with cranial nerve number 2. So this one tests visual acuity. So the first test we would do is the Snellen chart. So I'm just going to verbalize what we would do. We would have the patient stand 20 feet from the chart, and we would have him look at his left eye, his right eye, and both eyes. And then based on how he was able to see at which line, then we would be able to determine what his vision was in both eyes. So that would test central visual acuity, and to test peripheral visual acuity, we would do the confrontation test. So we're going to do that now. We've done this before, so I just want to make sure. So we're going to cover one eye, yes, but we're going to start with this eye, okay? And then I want you, I don't want to block the camera. I want you to tell me, move this way a little just so we're even, and look straight ahead and tell me when you can see my finger, okay? Say now.
No.
Okay.
No.
Okay.
No.
Okay.
No.
Okay. Look straight ahead. Other eye. Okay. Tell me when you can see my finger.
No.
Okay.
No.
Okay.
No.
Okay. One more.
No.
Okay. So that's good. That was testing the peripheral vision for cranial nerve number 2. Now for cranial nerve number 3, 4, and 6, we're going to test the extraocular eye movements. So we're going to start with this one. So I just want you to look straight ahead at this, and as I move it, I want your eyes to move. And we're going to test the 6 cardinal positions of gaze. Just look straight ahead and only your eyes move, okay? Okay, and then we're going to test for accommodation. Okay, and the eyes converged and they constricted, which is normal. And now we're going to test for the pupillary light reflex. So I have the light on. Okay, so just look straight ahead. Okay. Okay, and both the pupils constricted for the pupillary light reflex. So now we're going to test cranial nerve number 5. So there's two parts. There's a motor part and a sensory part. The motor part, I want you to clench your teeth really hard. Okay. So I know that the cranial nerve number 5 is intact because you can feel the muscles inverting, which means that cranial 5 is intact. So the second part is the sensory part. I want you to close your eyes, and I'm gonna wipe a tissue across your face in different areas. And when you feel when you feel the tissue, say now, okay?
No. 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 No.
Okay, perfect. So cranial nerve number 5 is intact. Okay, so the next nerve, we did 6 with the extraocular movement, so now we're going to test cranial nerve number 7. So I want you to follow my directions, smile really big, now frown, now lift your eyebrows up really high, and now squeeze your face together. Okay, so during those we're testing for symmetry, so we're looking at the eyebrows, the eyelids, the labial folds, the mouth, and everything looked symmetrical during the test. So cranial nerve number 8 is the whisper test. So I'm going to whisper something and I want you to repeat back to me what I say, okay?
Blue pants.
Okay.
Christmas tree.
Okay, perfect. So the cranial nerve number 8 is intact. So now for cranial nerve number 9 and 10, I'm going to I'm going to look in your mouth and I want you to look up a little and I want you to say ah.
Ah.
Okay, and so the uvula and the soft palate rose as he said ah, so cranial nerve 9 and 10 are good. So now I'm going to check cranial nerve number 11. So I want you to push against my hand. No, like turn your face that way, push again. Hard though. Okay, other one. Okay, good. And then I want you to push up against my hand. Shrug your shoulders up. Hard though. Okay, good. Okay, cranial nerve 11's intact, and then the last one's cranial nerve number 12. And I just want you to stick your tongue out real far. Okay, and the tongue is midline, so that's suggestive of cranial nerve 12 being intact. And that completes our neurological assessment.